Head now to Africa and the vaccine rollout underway there to combat Mpox, formerly known as monkeypox. Cases of the virus are rising at an alarming rate. The Democratic Republic of the Congo has seen a suspected 18,000 cases and recorded more than 600 cases so far this year. Nigeria now receiving 10,000 vaccine doses from the U.S., the first African country to obtain those shots. For more on the state of the Mpox health emergency in Africa, we're joined now by Dr. Jean Kaseya, the Director General of the Africa Centers for Disease Control and Prevention. Dr. Kaseya, thank you so much for joining us. We really appreciate it. Let's just start with the severity of what is happening with Mpox in Africa in the region right now. Talk to us about what you are seeing. What is the most concerning aspect to you?
Thank you so much for having me. I'm currently in DRC, where I came to meet leaders and also to discuss with communities, to go to visit some people who are affected. Yes, Mpox is a reality. Yes, Mpox is severe in DRC, and on daily basis we are reporting cases. And currently we have around 22,000 cases in Africa, and as you said, around 18,500 cases in DRC. Yes, we have also some countries, in addition to the 13 countries that we are reporting, we have 2 additional countries. They say they have suspected cases, but they don't have a machine to confirm these cases. It means the outbreak is really moving, and we have so many countries affected.
10,000 doses of vaccines, as we mentioned, arriving in Nigeria this week, but it really seems like that is a drop in the ocean of need. Your organization has estimated that 10 million doses is what is actually needed in Africa. Why has there been such a delay getting Mpox vaccines to the continent? And when do you expect there to be enough vaccines to meet the demand in the DRC and in other countries on that continent?
I believe that the world didn't listen from the COVID lesson. Let me remind you that in the early days of COVID-19, the virus was not immediately recognized as highly deadly or globally disruptive. Now, it's the same issue that is happening with Mpox. This is why Africa CDC took the proactive measure to read all data, to analyze data, and to make the decision to declare the public health emergency of continental security, followed by WHO a day later. Why the vaccine is not available? Because first, this vaccine is not manufactured in Africa. And second, because when the vaccine was manufactured, Western countries, they kept that for themselves. They didn't even share some doses to Africa. And today, we are facing this huge stock out of vaccine, even if there is some commitment to increase production. We already secured around 3.6 million doses, 3 million coming from Japan and 600,000 coming from Bavaria Nordic. But this one is still far from what we need exactly in Africa. And we are calling from our partners to come to join us to give more vaccine to Africa and to do the transfer of technology for Africa to start to manufacture also this vaccine. That will decrease the price and will increase availability.
Talk to us a little more about that, because I remember during the COVID-19 pandemic, there was this discussion of saying, okay, well, if, and this is going to be a non-medical way to describe it, but basically, if you would share that recipe with other countries, we could manufacture more and we could do it faster when there is a global need. Do you feel like that is something that could happen here, that this could be shared, the recipe, if you will, with different organizations or different countries inside of Africa where manufacturing could speed up that way? Or do you think it really is just going to be a situation where the ones that's already been made, those that have been developed, it should just be passed on?
This is what we don't want to hear from our partner. And we started to negotiate with this company called Bavaria Nordic, and we signed even a joint statement where they said they will be transfer of technology to African manufacturers. Even we already selected this African manufacturer that can benefit from this transfer of technology and to start to manufacture the vaccine. We believe that this one will become a reality because all of us were engaged. And we want also to say clearly to our partners, we need more vaccines for many reasons. The first one, our surveillance system is not strong enough. It means the number of cases we are giving you is just the peak of iceberg because we don't know exactly how many cases we have in Africa. We are not reporting based on the weakness of our surveillance system. The second one, we don't have machines to do the testing. You can imagine we have countries, the testing rate is still 18%. I was talking with a minister a few days ago. He was telling me we have suspected cases, but we cannot confirm. This is why we cannot declare the outbreak. And when you have this kind of context, you have to vaccinate so many people, target a number of groups to stop this outbreak. This is why we need so many vaccines in Africa now.
All right. Well, Dr. Jean Kaseya, thank you so much for the work you do and joining us tonight. We hope we can talk to you again soon when the situation improves. Thank you so much. We appreciate it.
Thank you for having me. Thank you so much.